Hi guys, Carrie Burnett here. I'm on to talk a little bit about trauma and massage therapy. For those of you that don't know me, I recently graduated from the Healing Arts Center, and for those of you who also graduated from the Healing Arts Center, you may hear some things in here that sound familiar. Great program there. And I'm also training as a somatic experiencing practitioner. For those of you that don't know what that is, somatic experiencing is a technique used to help trauma victims to sort of re-regulate their nervous system. So I am very passionate about helping people to heal from trauma. I am also a childbirth educator. I work with moms who have birth trauma, which is unfortunately very prevalent in our society right now. And so there's just some things I've learned. I have past trauma myself, and so there's some personal experience that's, taught me the things I know, and then all the training that I have and am still receiving. Just wanted to introduce myself a little bit. I am doing a 3-part series for this on trauma and massage therapy. The very first part I'm talking about today is how to create a safe space before the table. So sort of like office procedures and things like that that can help make the environment safe for trauma victims. So you may be asking yourself, why spend the time and energy doing this particularly? Because especially if you're not working specifically with trauma victims, you may feel a little bit like this is not, something you need to do, but I sort of feel like this is something that all massage therapists could benefit from. And the reason for that is just because that trauma is complex. Trauma is something that people don't always know they have. With the study of epigenetics, we're finding out that people may not even have memories associated with trauma reactions, and people may have repressed memories, they may have dissociation from it. So there's a lot of things that can go on that can make trauma present but unknown. And two, the things that I'm going to talk about today are really just about creating a safe environment and empowering people. And you really can't go wrong with that. So I think they're applicable regardless of what your practice looks like. And I think they're important. So one of the first things that I wanted to bring up is just talking about the difference between being trauma-informed and being somebody who works with trauma. And this is just sort of knowing your place in trauma recovery. So, being trauma-informed means that you have a passion for helping, you've educated yourself, and that's awesome. But there are certain risks that are associated with working with trauma, and there's certain, training that's very specific to dealing with these risks. So even myself, as somebody who's training as a somatic experiencing practitioner, I'm currently working with clients who have trauma, but I know my limits. I know the areas that I'm comfortable in. I know sort of when to say no, and I'm working with teachers that are helping me to. I can ask questions, things like that. So that's something that I have in place to help me know. But if you are somebody who wants to be working with trauma as a massage therapist, but maybe don't have the training to actually, do a specific modality around that, you can just make sure you have a list of resources and then knowing sort of what's appropriate and what's not appropriate. So, making sure your practice is trauma informed, everybody should do that. Or trauma safe for trauma victims, but maybe not taking them in or trying to work with that trauma unless you have training in that. So that's the first thing. Having a list of resources available, even if, I think all therapists should have a list of resources to help people with trauma or just all levels of healing, because that's such an awesome service to offer your clients. And then two, knowing that the best thing you can do for somebody sometimes is to actually refer them out to another practitioner. So even as somebody who's training in somatic experiencing, I've referred people out to other styles of therapy, other somatic experiencing practitioners that have more practice and more experience underneath their belt for certain cases that I didn't feel like I was qualified to work with. So just knowing that limit and working with it and making sure that you have resources available for people. So the other thing that I think is really important if you're creating a practice that is trauma-informed is integrating other modalities other than just effleurage, petrissage, or modalities that require skin-to-skin contact, because with trauma victims, some people might be triggered by the need to take their clothes off, and so that can be a hurdle for some people. So I think it's really important to have modalities that are clothed and have those options up front and knowledgeable to your clients. It may take time for a client to get comfortable with taking their clothes off. They may never, and that's okay. And I don't think that the quality of their massage should be compromised because of that discomfort. And so I think it's really important to make sure that as you're growing and changing and learning and taking your CEUs and things like that, that you're including things that can be utilized with clothes on. And most massage therapists, even in just like their training, have learned things like compressions and stretching and chair massage. And these are all things that can be done, and you can, modify things to work over clothes. So we just don't want to make clients feel like they have to be unclothed to experience the benefits of massage, because that's just not true. It is certainly, there is a benefit to working skin to skin, and that's something that I think we can acknowledge the presence of without needing to make them feel like they won't have any benefit without taking their clothes off, because we really want to make that safe for them. Other things you can look into are energy work like Reiki or pranic healing. These things can be really relaxing and amazing for people, and they don't need to be unclothed. If you're interested in somatic experiencing, I highly recommend it. It's a great program. And so I am including these practices in my literature about what I'm doing, and I'm advertising them because I want people to know that that's not a hurdle for you to get therapy. That's not a hurdle for you to get care, whether or not you're comfortable to take your clothes off. And then, once they get into the office and you're talking with them, just presenting it as an option once again. So, when people go to my website, they're going to see that those are options, or you can get chair massage, compression. I know some myofascial work that you can do over the clothes. And then when they come in, reinforcing that message and just saying, presenting it as an option, if you're comfortable undressing, so presenting it that way. I assure you my draping techniques are safe, so, just letting them know, naming the elephant in the room that you're good at draping and you've been trained in this, and that they're secure, and always be sure to only undress to your comfort level, and that we can work with whatever feels right for you. So I'm just really passionate about, I want people to know that they don't have to compromise the quality of what they're receiving in order to feel comfortable, so it shouldn't be like, okay, yeah, you can be undressed, but I'm going to give you this really crappy massage, no, they should still be treated where they're at, and we should really make them feel safe there. And then another thing that I think is important to do is before you actually get started, spending some quality time with a person, going over the list of what's going to happen in the massage. And I know that can sound a little bit daunting, especially because I don't think most massage therapists want it this way, but I think there's a lot of a dynamic out there where massage therapists sometimes are only seeing clients for 5 or sometimes 10 minutes before they're on the table and working. And I understand that like profit is behind that, and making sure that your hourly rate is well. But there is a really awesome benefit to spending time with clients. And I think if you really want to work with trauma victims, you need to understand that there's value in that, and it's necessary to spend the extra time, to go slow, and to make sure that it's not rushed, because you could miss something very important, and that could be very triggering for a person. So I like to have like a list of things, and even things that are like so mundane to us because we might do it all the time, listing those out, going over that with the client, and having them even initial to say, this is something that I've read and I'm okay with it, or scratch it out, I'm not okay with this, or I want to change this to look like this. So things like, we're going to undress to your comfort level, and we're going to get on the table, and there'll be a drape, and then there'll be a bolster, and then I'll be stepping out of the room while you get on the table, and then I'll knock at the door, and you can say this, and then I'll come back in. So just very step by step, and making sure that they're aware of everything along the way. This is a really empowering thing to do because somebody knows what to expect in advance. Even if somebody's had a massage before, if they're new to you, they may not know what your protocol is, how you handle that situation. So it's just really awesome to empower somebody through that knowledge, and then too, to let them interact with that. That's that informed consent part, If they want a pillow instead of a bolster, or if they want you to leave the lights on, or if they want to say, I'm okay with having my back worked on, but I'm not okay with having my feet worked on. This piece of paper would be where that would be discussed, and then after all of that, you would keep it with their intake form, and then every time they come in, you could have that attached to their intake form and show it to them and just say, just look this over. If anything's changed, let me know. Keeping that constant dialogue, because, as things get worked on, as you guys get more comfortable, things may come up, and that may cause more triggers, or it may cause less triggers. It might cause more comfort, more maybe standoffness. I don't know if that's a term. But so it's just important I think that encourages that constant dialogue. And then the last part that's really important is just encouraging, not only inviting, but encouraging the vocalization of our clients. So one of the hardest things about being a massage therapist, I think, is that people feel like they're going to offend you if they ask for a different pressure, or if they say they don't like that. And so something that I think is really valuable is just sort of like naming the elephant in the room and saying, I know a lot of times people are uncomfortable saying this, but I just really want to invite you to speak up if this is the case for you, and just letting them know that that's not going to offend you, that you're actually really excited to hear input when you hear it. And so telling them it's not going to hurt your feelings, naming the elephant, and then something that I like to say, some wording I like to say around all of that is, if I do anything that doesn't feel just right for you. My teacher at the Healing Arts Center made a really big point out of this, and I'm really appreciative, because what you're saying there isn't, if I do anything that's not right, because they're going to feel intimidated by that wording, because they don't know. They're not the massage therapist, but what you can say is just right for you, or even just right for that moment, because you're giving them the freedom and you're empowering them to say, this isn't right for me. It may be right for other people. You may be doing a textbook massage, but if it's not right for me, I need to speak up for that. And then I like to add in the wording, once again from my amazing teacher at the Healing Arts Center, I like to add in the wording right away. So if it's not just right for you or just right for that moment, let me know right away so I can change it. This is different than just saying, like, let me know, because somebody might say, hear that and say, okay, this bothered me, but they might wait till their next session to bring that up. And while that's really still helpful and good, it would feel awful as a massage therapist to know that they spent a whole session feeling uncomfortable about that and then waited until then to say it. So I just like to use that wording right now so that they feel empowered to speak up in the session, in the middle of the session. And then when the client does actually speak up, just remembering to be really grateful for that and expressing that gratitude. Thank you so much for speaking up. It really helps me to do my best job. I think that creating that rapport, that conversation, and don't be embarrassed. Don't be afraid to go over the top. Just say it. Thank you so much. I really appreciate that, because it is important to say that, because you're establishing a relationship that is safe, and that's one of the highest things that we can do as massage therapists. And then the last part about that is just to remember to make space for the client. Remembering not to wear what they say. I think, in a way we can avoid perpetuating that idea that they should be afraid to speak up by just being really welcoming and humble about that. Really checking our ego before we react to that, because it's not about you. Now, I say that with a caveat of you need to balance being confident and having healthy self-examination, because if every single one of your clients is saying ooh, that shoulder work hurts, yeah, okay, you might need to reevaluate how you're doing shoulder work and just be okay with that you're not perfect and that you might have to learn and grow as you go. But at the same time, if you have a client on the table and they say, oh, my shoulder hurts, that's an isolated event, you don't have to go there. You don't have to go to the place of oh, I'm not doing a good enough job, I'm not a great therapist. Just be confident in your skills and understand that this is how you're meeting that person in that moment on the table. And then too, just the whole confidence thing, just having confidence in who you are, and that you don't have to be perfect, and that, you're learning as you go, and that's perfectly normal and okay. I think that sort of takes some of that pressure off, for us to be perfect, and then the offensiveness of all of that can sort of just be evaporated from the situation. I just wanted to make a plug too, because, as some of you probably know, Soulshine, Sarah, who's in this group, she's a really beautiful massage therapist and has a beautiful heart and is very trauma-informed. And one of my favorite things about her practice is that when she has you come in on her intake form, it says something, and I'm not going to word this right, but something around if you need to talk while you're in this session, that's totally okay. Because a lot of times as massage therapists, we feel okay, people are here to relax and we need to help them be quiet, but I really I just loved that when I read it, because it's she's meeting the client where they're at. If that client needs to talk, that might be what that client needs for that day. Who am I to say be quiet? It actually might help them to relax, especially if we're working with somebody who's maybe uncomfortable. Talking could be a way that they get more comfortable. And so just really making space for that client and their particular needs and not trying to box them into anything, I think is really helpful. Let's see, make sure I didn't miss anything here, but just saying that once again, going over this stuff might seem a little bit mundane, but it's really important, because you never know how you could trigger someone, and doing these things it might bore somebody, or they might be that, oh, we have to sit here and go over this. I doubt they will, but they could. That's a possibility, I guess, on that side. And so the risk is very minimal to adding these things to your practice, but the risk of not doing this stuff, the risk of not making a safe environment for people is actually, pretty high, especially if you're interested in working with people who have trauma. You could be triggering them and not know it, and that could just be a a really bad situation for you and for the client. So we really just want to make sure that, you know, we're creating this environment where people feel safe and empowered, and that the rapport between the client and therapist is strong. Also, too, going back to that first point, just having resources, knowing what your limits are and working within them. And if you can keep all those things in your practice, I think, you know, that's a really great thing to offer our community, and people would be lucky to have you as a therapist. So that's all I've got for today. I hope to see you guys next week. I'm going to talk a little bit about this idea of compassionate touch, and sort of some of the details of what goes into that. If you have any questions or anything like that, feel free to comment, and I'll be on here for a little while and I can respond and answer them. Thanks so much for watching. I hope you guys have a great day.